Hi, I'm Dr. Brian Goldman, an ER physician and a medical broadcaster, back with another slang term for my new book, The Secret Language of Doctors, in which I explore the mysterious world of made-up words used by doctors, nurses, and other health professionals to talk about the things we do looking after you. If you watch TV shows like Grey's Anatomy, you've no doubt heard the phrase code blue, the almost universal term for a hospitalized patient whose heart has stopped. The instant a code blue is called, doctors and other health professionals on the code blue team drop everything they're doing and race to the patient's bedside, where they defibrillate the heart. You know, the moment when they yell clear on medical shows, when they intubate the patient, put them on a ventilator, and give them all sorts of medications to try and revive the heart. The slang term I want to tell you about this time is a slow code, also known as a Hollywood code, a light blue code, or a blue light code. Unlike a real code blue, in which doctors race to the patient, in a slow code, they walk, stroll, or saunter. They're slow to arrive on the scene, slow to check for signs of unresponsiveness, slow to check for a pulse, and slow to do every intervention from CPR to defibrillation. It's a play for time until it's acceptable to pronounce the patient deceased. Why would some doctors do a deceptive thing like that? For one thing, they believe it's largely futile to try and revive most patients who have a witnessed cardiac arrest in hospital. And they have a point. The only patients who are often saved by a code blue are those who suffer a witnessed cardiac arrest as the result of a heart attack caused by a blocked coronary artery. That's why they've put public access defibrillators in airports, casinos, hockey arenas, and other places. But hospitals are full of patients who have a cardiac arrest for other reasons, things like cancer, lung disease, and kidney failure. This may surprise you, but many studies have shown that only a small percentage of hospitalized people resuscitated in a code blue make it out of hospital alive. It's that futile. Given that, some of my colleagues believe it's unethical to do a real code blue in most cases. The trouble is, doctors are obliged to do the code blue unless the patient or the next of kin says it's okay not to. Some families don't want to do that because it feels like they're playing God. By doing a slow code, some doctors believe they can have it both ways, to satisfy the family by looking like they're doing a code blue when they aren't. I think any treatment that deceives patients and their families is wrong. On the other hand, I agree that it's largely futile to offer a code blue when a natural death is the final outcome for all of us. I just think it's better if doctors say that to families up front instead of doing things behind their backs. I'm Dr. Brian Goldman. If you liked hearing about the slow code, there's lots more hospital slang in The Secret Language of Doctors.